Tonight's second bedtime lesson is about bites and stings. Bites and stings are common and usually only cause minor irritation. Some stings can be painful and may trigger an allergic reaction. Symptoms of bites and stings. The main symptoms of a bite or sting are pain when you were stung or bitten, a small swollen lump on the skin, redness, and itching. These symptoms will usually continue for a few days after the bite or sting. Types of insect bites and stings. There are many types of insect bites and stings. These have different symptoms. First, we're going to look at the flea bite. Flea bites can cause small red spots on the skin. These may be grouped in clusters or lines. Sometimes itchy red lumps can form too. Flea bites are usually found around the ankles. They can also be found on the forearms if you've been stroking or holding your pet. Midge, mosquito, and gnat bite. Bites from midges, mosquitoes, and gnats can cause small papules or lumps to form onto the skin. They are usually very itchy. If you're particularly sensitive to insect bites, you may develop fluid-filled blisters or circular fluid-filled areas surrounding the bite. Mosquito bites in certain areas of the tropical countries can cause malaria. Bedbug bite. Bites from bed bugs aren't usually painful, but you may get a red lump on the skin. This can be itchy or irritating. Tick bite. Tick bites aren't usually painful, but you may get a red lump where you were bitten. In some cases, they can also may cause swelling, itching, blisters, or bruising. Ticks can carry a bacterial infection that causes Lyme disease. Many people with early symptoms of Lyme disease develop a circular rash around the tick bite. Lyme disease can be serious if it isn't treated. Watch a tick bite to see if a rash develops. A tick bite can cause a spreading rash or a bullseye rash. Horsefly bite. A bite from a horsefly can be very painful. It can cause a wheal or swollen mark around the bite. You may also experience hives, dizziness, weakness, wheezing, and angioedema, which means itchy, pale pink or red swellings. Horsefly bites can take a long time to heal and could cause an infection. Bee and wasp sting. A bee, wasp, or hornet sting can cause sharp pain in the area that was stung. This only usually lasts a few seconds. A swollen red mark will often form on your skin, which can be itchy and painful. You can remove a sting using your fingers. You can also brush it out using sometimes with a hard edge like a bank card. Do not use tweezers to remove a sting, as this could squeeze the venom from it. You should also wash the area with soap or water. Mite bite. Mites can cause very itchy lumps and blisters on the skin. They will bite any uncovered skin. Spider bite. It's rare to get a spider bite in the UK. Spider bites leave small puncture marks on the skin. This can be painful and may cause redness and swelling. And finally, jellyfish and other water creatures. Being barefoot on Scotland's beaches and shores can be enjoyable in sunny weather, but it can also increase the risk of being stung by wildlife like jellyfish, sea urchins, or weaver fish. If you're stung, you should rinse the affected area with seawater, not fresh water. Remove any spines or stings with tweezers. Do not use your fingers to remove them. Soak the site in warm water, as warm as you can tolerate, and take painkillers like paracetamol or ibuprofen to manage pain. You should not use an ice pack or press the wound. Most stings from sea creatures in Scotland are mild and can be safely self-managed. The Royal National Lifeboat Association have further information on sea creatures in Scotland. When to see a pharmacist. A pharmacist can advise you about medicines that can help you ease the symptoms of a bite or sting, like antihistamines, steroid creams, and painkillers. They can also provide other treatments if you need them, without you seeing a GP. Treatments for bites and stings. Most insect bites and stings only cause a small reaction that can be treated at home. Here are the do's and don'ts. Do's. Wash the area with soap and water. Place a cloth soaked in cold water over the area. Take a painkiller like paracetamol or ibuprofen if the area is painful or swollen. Take an antihistamine to help reduce swelling. Use a mild hydrocortisone cream on the affected area to prevent itching and swelling. And don't. Do not scratch the area as it could get infected, or do not use home remedies to treat a bite or sting. Preventing insect bites and stings. There are things you can do to help prevent insect bites and stings. If you come across wasps, hornets, or bees, don't panic or wave your arms around. You should move away slowly. If you're outside, cover your skin with long-sleeved clothing and shoes. Use insect repellent. Keep food covered, and avoid using strong perfumes that can attract insects. You should also keep your windows closed to stop insects getting indoors. If you want to go camping, avoid areas near water like lochs or rivers. Managing infestations. If you have been bitten by fleas or mites, you may have an infestation in your home. To manage this, you should speak to a vet about treatments for your pet. Treat bedding, carpets, and soft furnishings with insecticides, and vacuum carpets and soft furnishings. Bedbug infestations will need to be treated with insecticide. A pest control company will need to do this for you. Travelling abroad. There's a risk of catching diseases like malaria from insect bites in certain parts of the world. These include Africa, Asia, and South America. You may need to take anti-malarial tablets to avoid becoming infected. Time for a bedtime bird, and some jokes too.